Question 1. Cost-benefit analysis shows that a streamlined approach to QME evaluations could reduce administrative burdens. But how should a QME prioritize the assessment of disability in relation to work capacity when faced with conflicting medical evidence and varying subjective reports from an injured worker? Option A. Base the disability assessment solely on the most recent diagnostic imaging results, assuming these definitively represent the worker's current functional capacity, without further functional testing or consideration of other medical evidence. Option B. Focus on the objective medical findings and functional capacity assessments, correlating them with the worker's ability to perform the essential functions of their usual and customary occupation, while acknowledging and integrating subjective reports where they are consistent with objective data. Option C. Primarily rely on the injured worker's subjective description of pain and limitations, as this directly reflects their perceived ability to work, and adjust the disability rating accordingly. Option D. Prioritize the employer's stated need for the worker to return to modified duties quickly, even if it means downplaying some of the medical findings that suggest more significant limitations. Correct answer is B. Focus on the objective medical findings and functional capacity assessments, correlating them with the worker's ability to perform the essential functions of their usual and customary occupation, while acknowledging and integrating subjective reports where they are consistent with objective data. Explanation. This scenario presents a professional challenge for a qualified medical evaluator, QME, because it requires balancing the objective medical findings with the subjective impact of a condition on an individual's ability to perform work-related tasks. The QME must navigate the complexities of translating medical diagnoses and functional limitations into a clear assessment of work capacity, which directly influences an injured worker's benefits and return-to-work potential. This requires a nuanced understanding of both medical science and vocational principles, as well as strict adherence to the regulatory framework governing QME evaluations. The correct approach represents best professional practice because it aligns with the core purpose of a QME evaluation: to provide an objective, evidence-based assessment of disability that directly relates to work capacity. This involves a thorough review of all medical records, a comprehensive physical examination, and the application of established medical legal guidelines to determine the extent of impairment and its impact on the worker's ability to perform their usual and customary occupation or any other gainful employment. This approach ensures fairness to the injured worker by accurately reflecting their functional limitations, and to the system by preventing over- or underestimation of disability. Adherence to the specific regulations for QMEs in California, such as those outlined in the Labor Code and the relevant sections of the California Code of Regulations, is paramount. An incorrect approach that focuses solely on the medical diagnosis without considering its functional impact on work capacity is professionally unacceptable. This fails to meet the QME's statutory obligation to assess disability in relation to work capacity. It also violates ethical principles by not providing a complete picture of the worker's limitations, potentially leading to inadequate benefits or an unrealistic expectation of return to work. Another incorrect approach that relies heavily on the worker's subjective complaints without corroborating objective medical findings or functional assessments is also professionally unacceptable. While subjective reports are important, they must be integrated with objective data. Over-reliance on subjective reports can lead to an inaccurate assessment of disability and potentially inflate the perceived work capacity limitations beyond what is medically supported. This can undermine the integrity of the QME process and lead to disputes. A third incorrect approach that prioritizes the employer's desired outcome or the perceived cost of benefits over objective medical findings is a severe ethical and regulatory failure. QMEs are independent medical examiners and must remain impartial. Their duty is to the medical facts and the law, not to the financial interests of any party. Such an approach compromises the integrity of the QME process and violates the QME's oath to provide unbiased medical opinions. The professional decision-making process for similar situations involves a systematic approach. 1. Thoroughly review all available medical records, including prior evaluations, treatment history, and diagnostic tests. 2. Conduct a comprehensive physical examination and perform appropriate functional capacity evaluations relevant to the worker's occupation. 3. Integrate objective medical findings with the worker's reported symptoms and functional limitations. 4. Apply the relevant sections of the AMA guides to the evaluation of permanent impairment and California-specific medical legal guidelines to determine impairment. 5. Translate the assessed impairment into a determination of disability and work capacity, considering the worker's age, education, and vocational factors as permitted by law. 6. Clearly articulate the reasoning and basis for the conclusions in the QME report, referencing specific medical findings and regulatory requirements. 7. Maintain strict impartiality and avoid any influence from the parties involved. Question 2. Research into the effectiveness of different patient history taking techniques for qualified medical evaluators, QME, in California workers' compensation cases reveals that the quality of the historical narrative significantly influences the subsequent medical legal opinion. Considering the QME's duty to provide an objective and impartial evaluation, which of the following approaches to obtaining patient history is most aligned with regulatory requirements and best professional practice? Option A. Focusing the history taking on confirming the patient's pre-existing beliefs about the cause of their condition and the extent of their disability, as this can foster rapport and encourage cooperation. Option B. Relying heavily on information provided by the injured worker's attorney or representative, as they often have a comprehensive understanding of the case and can streamline the history-gathering process. Option C. Primarily asking a series of yes/no questions to quickly confirm specific details related to the mechanism of injury and pre-existing conditions, thereby ensuring efficiency in the evaluation process. Option D. Employing a structured interview format that begins with broad, open-ended questions about the injury and its consequences, followed by targeted, clarifying questions based on the patient's responses, while meticulously documenting all information provided. The correct answer is D. Employing a structured interview format that begins with broad, open-ended questions about the injury and its consequences, followed by targeted, clarifying questions based on the patient's responses, while meticulously documenting all information provided. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in patient history taking and the critical need for QMEs to remain impartial and objective. The QME's role is to provide an unbiased medical legal evaluation, and the quality of the patient history directly impacts the accuracy and validity of their findings. A thorough and well-documented history is foundational to a credible QME report. The correct approach emphasizes a structured, open-ended, and non-leading questioning technique, coupled with active listening and careful documentation. This aligns with best professional practice by ensuring the patient's narrative is captured comprehensively and without undue influence. Regulatory frameworks for QMEs, such as those governing medical evaluations in workers' compensation systems, mandate thoroughness and impartiality. A structured approach allows the QME to gather all necessary information relevant to the claimed injury and its impact, while open-ended questions encourage the patient to provide details in their own words, minimizing the risk of introducing bias. Active listening and detailed documentation are crucial for creating a reliable record that can withstand scrutiny and accurately reflect the patient's reported experience. An incorrect approach that relies on leading questions or assumptions is professionally unacceptable. Leading questions can inadvertently steer the patient's responses, potentially distorting the history to fit a preconceived notion or to elicit a desired answer. This violates the ethical obligation of impartiality and the regulatory requirement for an objective evaluation. Similarly, a superficial or incomplete history taking, characterized by a lack of probing or a failure to explore all relevant areas, compromises the integrity of the QME's assessment. This can lead to inaccurate conclusions about causation, impairment, or disability, failing to meet the professional standard of care and potentially violating regulations that require a comprehensive evaluation. The professional decision-making process for QMEs in patient history taking should involve a commitment to impartiality, a thorough understanding of the relevant medical legal issues, and the application of evidence-based interviewing techniques. Professionals should prioritize gathering information directly from the patient in a neutral manner, actively seeking to understand their perspective and experiences without imposing their own interpretations. This involves a continuous self-assessment to ensure questions are open-ended and that the narrative is being fully explored. When in doubt, It is always better to ask clarifying questions or to document the limitations of the information obtained. Question 3. The assessment process reveals that an injured worker's treating physician has provided extensive documentation supporting a diagnosis of chronic pain directly related to a specific industrial injury. However, the employer's representative has strongly suggested to the QME that the worker's pain is primarily due to pre-existing degenerative conditions and has provided medical records from prior treating physicians that appear to focus on non-industrial complaints. In this scenario, what is the QME's primary responsibility regarding the conflicting medical information and the employer's suggestion? Option A. The QME should defer to the treating physician's opinion, as they have the longest-standing relationship with the patient and are therefore best positioned to assess the injury's impact. Option B. The QME should primarily rely on the employer's provided medical records and suggestions, as the employer has a vested interest in ensuring the accuracy of the claim's adjudication. Option C. The QME must independently evaluate all provided medical records, conduct a thorough examination, and render an objective medical legal opinion on causation and apportionment based on the preponderance of the evidence, regardless of the employer's suggestions or the treating physician's initial findings. Option D. The QME should focus solely on the worker's current complaints during the examination and disregard prior medical records that do not directly pertain to the industrial injury. The correct answer is C. The QME must independently evaluate all provided medical records, conduct a thorough examination, and render an objective medical legal opinion on causation and apportionment based on the preponderance of the evidence, regardless of the employer's suggestions or the treating physician's initial findings. Explanation. The assessment process reveals a complex interplay of medical findings and legal requirements, placing the qualified medical evaluator, QME, in a position of significant responsibility. The challenge lies in the QME's dual role, to provide an objective medical opinion based on scientific evidence, and to ensure this opinion adheres strictly to the specific legal and regulatory framework governing workers' compensation in California. The QME must navigate potential conflicts of interest, maintain impartiality, and communicate findings clearly and accurately within the defined parameters of their statutory duties. The correct approach emphasizes the QME's primary obligation to conduct a thorough, independent medical evaluation and to report findings in accordance with California Labor Code sections and relevant administrative rules. This involves a comprehensive review of medical records, a direct examination of the injured worker, and the application of established medical legal principles to determine causation, apportionment, impairment, and disability. The QME's report must be objective, evidence-based, and directly address the specific questions posed by the parties or the Workers' Compensation Appeals Board, WCAB, thereby fulfilling their role as an impartial expert assisting the adjudicative process. This aligns with the QME's statutory mandate to provide unbiased medical opinions that are crucial for fair resolution of claims. An incorrect approach that prioritizes the desires or expectations of one party over objective medical findings represents a failure of impartiality and a violation of the QME's ethical and legal obligations. This could manifest as tailoring the report to support a specific outcome, thereby compromising the integrity of the evaluation. Another incorrect approach, such as failing to conduct a complete examination or neglecting to review all relevant medical documentation, undermines the foundation of the medical legal opinion and can lead to inaccurate conclusions. Such omissions or biases are not only professionally unacceptable, but also violate the QME's duty to provide a comprehensive and accurate assessment as required by law. Furthermore, misinterpreting or misapplying the specific reporting requirements outlined in the California Code of Regulations, Title 8, would also constitute a regulatory failure. Professionals should approach such situations by first understanding the precise scope of their duties as defined by the relevant statutes and regulations. This involves a commitment to impartiality, a rigorous adherence to evidence-based medicine, and meticulous attention to procedural requirements. When faced with conflicting information or pressures, the QME must rely on their professional judgment, grounded in medical expertise and legal compliance, to produce a report that is both medically sound and legally defensible. The decision-making process should prioritize objectivity, thoroughness, and adherence to the established framework for QME evaluations. Question 4. Cost-benefit analysis shows that using precise, universally understood medical terminology and avoiding ambiguous abbreviations in QME reports significantly reduces the likelihood of claim disputes and appeals. A QME is preparing a report for a patient with a diagnosed rotator cuff tear. Which of the following practices best adheres to the regulatory framework for QME reporting in California? Option A. Clearly stating rotator cuff tear and defining any necessary abbreviations, such as ROM for range of motion, in a glossary at the end of the report. Option B. Using the abbreviation RCT for rotator cuff tear without further definition, assuming all parties are familiar with this common orthopedic shorthand. Option C. Employing a highly specific but less common medical term for the tear that is only recognized by specialists in that particular subfield of orthopedics. Option D. Including a brief, informal note to the claims adjuster explaining the meaning of any abbreviations used, rather than formally documenting them in the report. The correct answer is B. Using the abbreviation RCT for rotator cuff tear without further definition, assuming all parties are familiar with this common orthopedic shorthand. Explanation. This scenario is professionally challenging because a qualified medical evaluator, QME, must ensure that their medical reports are clear, accurate, and comprehensible to all parties involved, including the injured worker, their legal representatives, and the Workers' Compensation Appeals Board. Misinterpreting or misusing common medical terms and abbreviations can lead to significant misunderstandings, delays in treatment, incorrect benefit determinations, and potential legal disputes. The QME's primary duty is to provide an objective medical evaluation based on the evidence, and the clarity of their communication is paramount to fulfilling this duty. The correct approach represents best professional practice because it prioritizes accuracy and clarity in medical reporting, directly aligning with the QME's ethical and regulatory obligations. Specifically, adhering to established medical terminology and avoiding ambiguous abbreviations ensures that the report is understood by all parties, preventing misinterpretation of the worker's condition, prognosis, and work restrictions. This promotes fair and efficient processing of the worker's compensation claim. An incorrect approach involving the use of obscure or non-standard abbreviations would be a regulatory failure. QME regulations require reports to be understandable. Using an abbreviation like ROM without defining it, when range of motion is the standard and unambiguous term, could lead to confusion for a layperson or even a legal professional unfamiliar with that specific shorthand. This lack of clarity undermines the integrity of the report and the QME's professional responsibility. Similarly, using a colloquial or internally understood abbreviation that is not universally recognized in medical or legal contexts would also constitute a failure to communicate effectively and adhere to reporting standards. The professional decision-making process for similar situations should involve a constant self-assessment of communication clarity. For finalizing any report, a QME should consider: would someone unfamiliar with this specific abbreviation or term understand its meaning in this context? If there is any doubt, the full term should be used, or a glossary of abbreviations should be appended to the report. This proactive approach ensures compliance with reporting requirements and upholds the QME's commitment to providing clear and objective medical evaluations. Question 5. Which approach would be most appropriate for a qualified medical evaluator, QME, conducting a musculoskeletal assessment to objectively evaluate an injured worker's range of motion, strength, and the presence of specific orthopedic impairments? Option A. Focusing exclusively on range of motion measurements using a visual estimation method, while neglecting strength testing and specific orthopedic special tests. Option B. Employing standardized goniometry for range of motion, validated manual muscle testing grades or dynamometry for strength, and recognized special orthopedic tests, all meticulously documented with clear methodology and findings. Option C. Utilizing a mix of informal, patient-reported observations and a few arbitrarily selected special tests without a consistent protocol. Option D. Relying primarily on the injured worker's subjective description of their limitations and pain levels during movement, without objective measurement. The correct answer is B. Employing standardized goniometry for range of motion, validated manual muscle testing grades or dynamometry for strength, and recognized special orthopedic tests, all meticulously documented with clear methodology and findings. Explanation. This scenario presents a professional challenge because a qualified medical evaluator, QME, must ensure their musculoskeletal assessment, specifically range of motion, strength testing, and special tests, is both clinically sound and compliant with the regulatory framework governing QMEs. The risk lies in employing methods that are either not evidence-based, not standardized, or not adequately documented, which could lead to inaccurate findings, disputes, and potential disciplinary action. Careful judgment is required to select an approach that maximizes objectivity and reliability. The correct approach represents best professional practice because it prioritizes standardized, objective, and reproducible methods for assessing musculoskeletal function. This aligns with the QME's duty to provide an unbiased and accurate evaluation, utilizing established protocols for range of motion, e.g., goniometry, validated strength testing methodologies, e.g., dynamometry or standardized manual muscle testing grades, and recognize special tests for specific pathologies ensures that the findings are defensible and can be reliably replicated. This adherence to best practices is implicitly or explicitly required by the regulatory framework, which mandates competent and objective medical evaluations. An incorrect approach that relies solely on subjective patient reports without objective measurement fails to meet the QME's obligation for independent medical evaluation. This is a regulatory failure, as it bypasses the requirement for objective findings. Another incorrect approach that uses non-standardized or ad hoc testing methods introduces significant variability and bias, making the findings unreliable and not in accordance with the expectation of a competent medical evaluation. This can be considered an ethical failure due to the lack of due diligence, and a potential regulatory failure if the framework specifies adherence to recognized clinical standards. A third incorrect approach that focuses on a limited subset of tests without a comprehensive musculoskeletal examination risks overlooking crucial findings, leading to an incomplete and potentially inaccurate assessment. This is a professional failing that undermines the integrity of the QME process and may violate regulatory expectations for thoroughness. The professional decision-making process for similar situations involves a systematic evaluation of available assessment tools and techniques. Professionals should first consult the specific regulatory guidelines for QMEs to understand any mandated or recommended methodologies. They should then consider the clinical evidence supporting the validity and reliability of various assessment approaches for the specific condition being evaluated. Finally, the chosen approach must be meticulously documented, detailing the methods used, the findings, and the rationale for their interpretation, ensuring transparency and accountability. Question 6. The review process indicates that a claimant presents with a history of a fall at work, complaining of persistent lower back pain. Imaging studies, including lumbar spine X-rays and an MRI, have been performed. The radiologist's report notes moderate degenerative disc disease and facet arthropathy, with no acute fractures or dislocations identified. The claimant's treating physician's notes mention the fall as the precipitating event for the current pain. As a qualified medical evaluator, QME, how should you interpret these imaging findings in relation to the industrial injury? Option A. Critically evaluate the imaging findings in conjunction with the claimant's reported mechanism of injury and subjective complaints to determine if the industrial event exacerbated or aggravated pre-existing degenerative conditions. Option B. Disregard the imaging findings entirely, as they do not show clear evidence of acute trauma directly caused by the fall. Option C. Focus solely on the radiologist's report, accepting their interpretation of degenerative changes as definitive evidence of pre-existing conditions. Option D. Conclude that the degenerative findings are unrelated to the industrial injury, as no acute traumatic changes were identified on imaging. The correct answer is D. Conclude that the degenerative findings are unrelated to the industrial injury, as no acute traumatic changes were identified on imaging. Explanation. Scenario analysis. This scenario presents a challenge for a qualified medical evaluator, QME, because it requires interpreting complex imaging findings in the context of a specific industrial injury claim. The QME must not only understand the radiological findings, but also correlate them with the reported mechanism of injury and the claimant's subjective complaints. The difficulty lies in distinguishing between pre-existing degenerative changes and those directly attributable to the industrial event, a common point of contention in workers' compensation cases. Accurate interpretation is crucial for determining causation, impairment, and the need for further treatment, directly impacting the claimant's benefits and the employer's liability. Correct approach analysis. The correct approach involves a comprehensive review of all available information, including the claimant's medical history, the mechanism of injury as described, the treating physician's reports, and the imaging studies themselves. The QME must critically evaluate the imaging findings, e.g., X-rays, MRI, CT scans, for evidence of acute trauma such as fractures, dislocations, or acute soft tissue tears, and compare these findings with the claimant's reported symptoms and the timeline of the injury. If the imaging shows degenerative changes, the QME must assess whether the industrial injury exacerbated or aggravated these pre-existing conditions, or if the findings are entirely unrelated. This requires a nuanced understanding of how specific types of trauma can affect different anatomical structures and how these effects might manifest on imaging, distinguishing them from age-related or chronic wear and tear. The QME's report must clearly articulate the reasoning for their conclusions, referencing specific imaging findings and their correlation with the injury. This aligns with the QME's duty to provide an objective medical evaluation based on the preponderance of medical evidence, as mandated by California workers' compensation regulations. Incorrect approaches analysis. One incorrect approach would be to solely rely on the radiologist's report without independent critical review of the images. While radiologists are experts in image interpretation, their reports may not always fully integrate the clinical context of an industrial injury claim. QME has a responsibility to review the images directly to ensure the radiologist's interpretation is consistent with the clinical presentation and mechanism of injury. Failure to do so could lead to misattributing findings or overlooking subtle but significant injury-related changes. Another incorrect approach would be to ignore imaging findings that appear to be degenerative and focus only on findings that clearly suggest acute trauma. This is problematic because industrial injuries can certainly exacerbate pre-existing degenerative conditions. The QME must address all relevant findings, even if they are not directly caused by the industrial event, to provide a complete picture of the claimant's condition and its relationship to the injury. A third incorrect approach would be to make a definitive statement about causation based on imaging alone, without considering the claimant's subjective complaints and the reported mechanism of injury. Imaging provides objective data, but it must be interpreted in conjunction with the clinical picture. For example, a minor finding on imaging might be highly significant if it correlates with severe pain and functional loss following a specific traumatic event. Conversely, a more significant finding might be deemed unrelated if it does not align with the reported injury. Professional reasoning. Professionals in this role must adopt a systematic approach. First, thoroughly review all documentation, including the claimant's history, mechanism of injury, and prior medical records. Second, carefully examine the imaging studies themselves, looking for both acute traumatic findings and evidence of pre-existing conditions. Third, correlate these imaging findings with the claimant's reported symptoms and the reported mechanism of injury. Fourth, consider the opinions of other treating physicians and consulting specialists, but ultimately form an independent medical opinion based on the preponderance of the evidence. Finally, clearly and concisely document the reasoning in the QME report, addressing all relevant issues and providing a well-supported conclusion regarding causation, impairment, and treatment recommendations. This methodical process ensures objectivity and adherence to regulatory requirements. Question 7. The analysis reveals a QME evaluating a patient with chronic low back pain that has persisted for 6 months, despite a course of conservative treatment including physical therapy and NSAID. The patient expresses significant frustration and a strong desire for an MRI to understand the cause of their ongoing pain and explore further treatment options. The QME's physical examination reveals no neurological deficits, no signs of cauda equina syndrome, and no other red flags that would typically necessitate immediate advanced imaging. However, the patient's subjective report of pain is severe and significantly limits their daily activities and ability to return to work. Considering the indications and contraindications for imaging in the context of California workers' compensation, what is the most appropriate course of action for the QME? Option A. Order a CT scan of the lumbar spine instead of an MRI, as it is generally less expensive and may provide sufficient information. Option B. Order an MRI of the lumbar spine, as the patient's subjective pain is severe and significantly impacting their function, and the patient desires further investigation. Option C. Refer the patient to a pain management specialist for consideration of interventional procedures without ordering further imaging. Option D. Recommend continued conservative management and pain management strategies, documenting the lack of objective findings and red flags that would justify advanced imaging at this time, while explaining the rationale to the patient. Correct answer is B. Order an MRI of the lumbar spine, as the patient's subjective pain is severe and significantly impacting their function, and the patient desires further investigation. Explanation. The analysis reveals a scenario where a qualified medical evaluator, QME, faces an ethical dilemma regarding the necessity of advanced imaging for a patient presenting with chronic low back pain. The challenge lies in balancing the patient's desire for definitive diagnostic answers and potential treatment options with the QME's professional responsibility to order imaging only when medically indicated, avoiding unnecessary radiation exposure, cost, and the potential for overdiagnosis or incidental findings. This requires a deep understanding of the indications and contraindications for imaging as outlined in relevant California workers' compensation regulations and medical guidelines. The correct approach represents best professional practice because it adheres strictly to established medical guidelines and regulatory requirements for diagnostic imaging in the context of workers' compensation. Specifically, it prioritizes a thorough clinical examination and conservative management before resorting to advanced imaging, aligning with the principle of ordering tests only when they are likely to change management or provide essential diagnostic information. This approach minimizes patient risk and healthcare costs, while ensuring that any imaging ordered is justified by objective clinical findings and the potential for a significant impact on the patient's diagnosis and treatment plan, as mandated by California Code of Regulations, Title 8, Section 10630, and the relevant official disability guidelines ODGE, or American College of Occupational and Environmental Medicine, ACOEM, guidelines incorporated by reference. An incorrect approach that involves ordering advanced imaging, such as an MRI, solely based on the patient's subjective complaint of chronic pain without clear objective findings or red flags, would be a regulatory and ethical failure. This would violate the principle of medical necessity, potentially leading to unnecessary radiation exposure and associated risks, increased healthcare costs, and the possibility of discovering incidental findings that do not contribute to the patient's work-related injury or disability. Such an action could be seen as a failure to adhere to the standards of care and the specific requirements for diagnostic testing within the workers' compensation system, potentially leading to a finding of medical legal opinion that is not supported by objective evidence. Another incorrect approach, such as refusing to consider any imaging despite persistent, debilitating symptoms that are not improving with conservative care and are significantly impacting the patient's ability to function, could also be problematic. While avoiding unnecessary imaging is crucial, a complete refusal without a clear clinical rationale and documentation of the patient's response to conservative treatment might be considered a failure to adequately evaluate the patient's condition and explore all appropriate diagnostic avenues, potentially contravening the duty to provide comprehensive medical evaluation. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's history, a comprehensive physical examination, and a careful consideration of the established indications for imaging based on the specific condition and the patient's presentation. This includes identifying any red flags that warrant immediate advanced imaging. If conservative management has been attempted and failed, and the clinical picture suggests a need for further diagnostic clarification that will directly influence treatment decisions, then ordering appropriate imaging becomes medically indicated. The QME must document the rationale for ordering or not ordering imaging, ensuring it aligns with regulatory requirements and best medical practices. Question 8. Strategic planning requires a qualified medical evaluator, QME, to anticipate potential challenges in providing an objective medical legal evaluation. If a QME receives a request for an evaluation where the requesting party has expressed strong opinions about the expected outcome, what is the most ethically and legally sound approach for the QME to adopt? Option A. Include speculative opinions based on the requesting party's narrative to demonstrate a comprehensive understanding of their viewpoint, even if not fully supported by objective medical data. Option B. Proceed with the evaluation, ensuring all findings are meticulously documented and the rationale for all conclusions is clearly articulated, regardless of the requesting party's expressed expectations. Option C. Adjust the medical findings to subtly align with the requesting party's stated expectations to foster a more cooperative relationship and expedite the process. Option D. Focus the evaluation primarily on the information provided by the requesting party, as their perspective is crucial for understanding the context of the case. The correct answer is B. Proceed with the evaluation, ensuring all findings are meticulously documented and the rationale for all conclusions is clearly articulated, regardless of the requesting party's expressed expectations. Explanation. This scenario presents a professional challenge due to the inherent tension between a QME's duty to provide an objective medical evaluation and the potential for external pressures to influence their findings. The QME must navigate the complexities of medical legal reporting, ensuring that their opinions are solely based on the medical evidence and established scientific principles, free from bias or undue influence. This requires a robust understanding of ethical guidelines and legal mandates governing QME practice in California. The correct approach represents best professional practice because it prioritizes the integrity of the medical legal evaluation by clearly documenting the rationale for all conclusions and explicitly stating any limitations or uncertainties. The QME upholds their ethical obligation to provide an unbiased and accurate assessment. This transparency builds trust in the process and ensures that decisions are based on sound medical legal reasoning, as mandated by California Labor Code sections and relevant administrative rules governing QMEs. An incorrect approach that involves omitting relevant medical findings to align with a perceived expectation would be a significant ethical and regulatory failure. This constitutes a misrepresentation of the medical facts and violates the QME's duty of impartiality. Such an action undermines the credibility of the evaluation and can lead to incorrect legal outcomes, potentially violating California Code of Regulations, Title 8, Section 37. This also breaches the ethical principle of honesty and integrity in professional practice. Another incorrect approach, such as relying on anecdotal information or opinions not supported by objective medical evidence, is also professionally unacceptable. QME reports must be grounded in scientific evidence and established medical literature. Introducing unsubstantiated claims or personal beliefs not directly related to the patient's condition and its causation would violate the standards for medical legal reporting and could be seen as practicing outside the scope of the QME's expertise or ethical boundaries. This would contravene the requirement for evidence-based opinions as outlined in the relevant California statutes and regulations. The professional decision-making process for similar situations should involve a systematic review of the medical records, a thorough examination of the patient, and a careful application of medical knowledge to the legal questions presented. The QME must constantly assess for potential conflicts of interest or external pressures that could compromise objectivity. When faced with ambiguity or conflicting information, the QME should clearly articulate these challenges in the report and provide a reasoned opinion based on the preponderance of the evidence, rather than attempting to force a conclusion that is not medically supported. Adherence to the California Labor Code and the administrative regulations governing QMEs is paramount. Question 9. Governance review demonstrates that a qualified medical evaluator, QME, has received a request for an independent medical evaluation concerning a worker's compensation claim. The claimant's treating physician has provided extensive documentation detailing the patient's subjective complaints and a diagnosis. The QME has also received a report from the claimant's attorney outlining the desired outcome of the evaluation. In formulating their medical legal report, which approach best adheres to the QME's regulatory obligations and ethical standards. Option A. Focus on the claimant's subjective complaints as described by the patient and their attorney, as these are the primary indicators of the impact of the injury. Option B. Primarily rely on the diagnosis and treatment recommendations provided by the claimant's treating physician, as they have the most comprehensive understanding of the patient's history. Option C. Conduct a thorough review of all submitted medical records, perform a comprehensive independent medical examination, and synthesize all objective findings with accepted medical legal principles to answer the specific questions posed by the administrative body, documenting all reasoning. Option D. Expedite the evaluation process by reviewing only the most recent medical records and conducting a brief examination to provide a timely response to the requesting authority. The correct answer is C. Conduct a thorough review of all submitted medical records, perform a comprehensive independent medical examination, and synthesize all objective findings with accepted medical legal principles to answer the specific questions posed by the administrative body, documenting all reasoning. Explanation. This scenario presents a professional challenge because the qualified medical evaluator, QME, must navigate conflicting information and potential bias to provide an objective medical evaluation, adhering strictly to the established regulatory framework for QMEs. The core of the challenge lies in maintaining impartiality and ensuring the evaluation is based solely on accepted medical principles and the specific requirements of the workers' compensation system, rather than external pressures or incomplete data. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based evaluation that directly addresses the specific questions posed by the workers' compensation system. This involves a systematic review of all available medical records, a comprehensive independent medical examination, and the application of accepted medical legal principles to reach conclusions. This aligns with the QME's ethical and regulatory obligation to provide an unbiased opinion that assists the administrative body in making informed decisions regarding the claim. The QME must document their findings and reasoning meticulously, ensuring transparency and accountability. An incorrect approach that relies solely on the treating physician's opinion without independent verification fails to meet the QME's statutory duty. This is a regulatory failure, as it bypasses the requirement for an independent medical evaluation and may perpetuate any inaccuracies or biases present in the prior treatment records. Another incorrect approach that focuses on the patient's subjective complaints without objective medical findings to support them is also a regulatory and ethical failure. QME evaluations must be grounded in objective medical evidence and accepted medical legal principles, not solely on patient self-reporting, which can be influenced by various factors. Finally, an approach that attempts to expedite the evaluation by omitting key steps, such as a comprehensive examination or detailed record review, constitutes a significant regulatory failure. This compromises the integrity of the evaluation and violates the QME's duty to conduct a thorough and accurate assessment. Professionals should employ a decision-making framework that begins with clearly identifying the scope of the evaluation and the specific questions to be answered. This framework involves systematically gathering and reviewing all relevant documentation, conducting a comprehensive independent medical examination, and applying established medical legal guidelines and principles. Crucially, it requires maintaining strict impartiality, documenting all findings and reasoning thoroughly, and communicating conclusions clearly and concisely to the requesting authority. Any deviation from these steps, or the introduction of external biases, should be recognized as a potential regulatory or ethical breach. Question 10. During the evaluation of a patient presenting with chronic back pain and radiating leg symptoms, which of the following sequences of physical examination skills best exemplifies a systematic and comprehensive approach for a qualified medical evaluator, QME, to gather objective data? Option A. Visually inspecting the patient's posture and gait, then palpating the lumbar spine for tenderness and muscle spasm, followed by assessing range of motion and neurological function. Option B. Palpating the lumbar spine for tenderness, then auscultating bowel sounds, followed by percussing the chest, and ending with a visual inspection of the patient's gait. Option C. Auscultating the patient's lungs and heart, then percussing the abdomen, followed by palpating the lower extremities for edema, and concluding with a brief visual inspection of the back. Option D. Performing a thorough inspection of the patient's back and lower extremities, followed by palpation to identify areas of tenderness, then using percussion to assess for bony abnormalities, and finally auscultating the abdomen and chest for any referred pain indicators. The correct answer is A. Visually inspecting the patient's posture and gait, then palpating the lumbar spine for tenderness and muscle spasm, followed by assessing range of motion and neurological function. Explanation. Scenario analysis. This scenario presents a professional challenge because the qualified medical evaluator, QME, must accurately assess the patient's physical condition to determine the extent of injury and its impact on their ability to work. The challenge lies in systematically applying the fundamental physical examination techniques of inspection, palpation, percussion, and auscultation to gather objective data, ensuring that each step is performed thoroughly and without bias. The QME must also be mindful of the patient's comfort and privacy throughout the examination, adhering to ethical standards and regulatory requirements for medical evaluations. The goal is to produce a comprehensive and defensible report that accurately reflects the findings. Correct approach analysis. The correct approach involves a systematic and sequential application of all four core physical examination techniques: inspection, palpation, percussion, and auscultation. Inspection allows for visual observation of the patient's posture, gait, skin integrity, and any visible deformities or swelling. Palpation follows to assess tenderness, temperature, texture, and masses. Percussion is used to evaluate underlying structures by producing sound waves, particularly useful for assessing the chest and abdomen. Auscultation, using a stethoscope, is crucial for listening to internal body sounds, such as heart, lung, and bowel sounds. This comprehensive approach ensures that all relevant physical findings are documented, providing a robust foundation for the QME's conclusions regarding the patient's condition and work capacity. In line with the standards expected of a QME, incorrect approach is analysis. One incorrect approach would be to focus solely on inspection and palpation, neglecting percussion and auscultation. This would lead to an incomplete physical assessment, potentially missing critical findings related to internal organ function or structural abnormalities that could significantly impact the patient's disability. This failure to conduct a thorough examination violates the implicit duty of care and the expectation of a comprehensive evaluation required by QME regulations. Another incorrect approach would be to perform the examination in a haphazard or non-sequential manner, jumping between techniques without a logical flow. This can lead to missed findings, confusion in documentation, and a less efficient examination. It also undermines the credibility of the QME's findings, as a structured approach is a hallmark of professional medical practice. Regulatory guidelines for QMEs emphasize the importance of a systematic and objective evaluation process. A third incorrect approach would be to rely heavily on the patient's subjective reporting, without corroborating it with objective physical findings from all four examination techniques. While subjective complaints are important, the QME's role is to objectively assess the physical basis for those complaints. Failing to perform a complete physical examination to validate subjective reports would be a significant deviation from best practices and regulatory expectations for a QME. Professional reasoning. Professionals should approach physical examinations by first understanding the patient's chief complaint and relevant history. This guides the focus of the examination. Then, they should systematically apply inspection, palpation, percussion, and auscultation in a logical sequence, adapting the depth and breadth of each technique based on the presenting problem. Documentation should be precise, objective, and directly linked to the examination findings. If any technique is contraindicated or not feasible, this should be clearly noted with justification. The QME must always prioritize patient safety, comfort, and dignity while ensuring the examination is thorough enough to support their medico-legal conclusions. Question 11. The risk matrix shows a potential for undue influence on the qualified medical evaluator, QME, by the employer, who has expressed a strong desire for the evaluation to support a specific outcome regarding the employee's work capacity. The QME has received all relevant medical records and has conducted a thorough examination of the employee. Considering the definition and purpose of medical evaluations within the QME framework, which of the following approaches best aligns with the QME's professional obligations? Option A. The QME should prioritize the employer's stated concerns and frame the medical findings in a manner that directly addresses and validates those concerns, even if it requires a less comprehensive interpretation of the overall medical picture. Option B. The QME should subtly emphasize findings that are more likely to support the employer's desired outcome, while downplaying any contradictory medical evidence to foster a cooperative relationship with the employer. Option C. The QME should consult with the employer's legal counsel to understand the precise wording and conclusions that would be most beneficial to the employer's case before finalizing the evaluation. Option D. The QME should meticulously document all findings, interpret the medical evidence objectively based on established diagnostic criteria and accepted medical principles, and provide an opinion solely on the employee's medical condition and its impact on work capacity, irrespective of the employer's expressed desires. The correct answer is D. The QME should meticulously document all findings, interpret the medical evidence objectively based on established diagnostic criteria and accepted medical principles, and provide an opinion solely on the employee's medical condition and its impact on work capacity, irrespective of the employer's expressed desires. Explanation: this scenario presents a professional challenge because the qualified medical evaluator, QME, must navigate the inherent tension between the employer's request for a specific outcome and the ethical and regulatory obligation to provide an objective, unbiased medical evaluation. The employer's implicit pressure to align findings with their desired outcome creates a conflict of interest that, if not managed properly, can compromise the integrity of the QME process. Careful judgment is required to ensure that the evaluation is based solely on medical evidence and established diagnostic criteria, rather than external influence. The correct approach represents best professional practice because it adheres strictly to the definition and purpose of a QME evaluation as mandated by the regulatory framework. A QME's primary purpose is to provide an independent medical opinion on the nature, extent, and causation of an injury or illness, and to determine the appropriate medical treatment and disability. This involves a thorough review of all relevant medical records, a comprehensive physical examination, and the application of accepted medical principles. By focusing solely on the medical facts and the patient's condition, the QME upholds their duty to provide an impartial assessment, which is the cornerstone of the QME system. This aligns with the regulatory requirement for QMEs to be unbiased and to base their opinions on objective medical findings. An incorrect approach that focuses on fulfilling the employer's perceived expectations would represent a significant regulatory and ethical failure. Such an approach compromises the QME's impartiality, a fundamental requirement. It violates the principle that medical evaluations must be based on objective findings, not on the desires of a party involved in the case. This could lead to an inaccurate assessment of the employee's condition, potentially resulting in inappropriate treatment, denial of necessary benefits, or an unfair determination of disability. Furthermore, it undermines the trust placed in QMEs by the regulatory bodies and the injured workers they serve. Another incorrect approach that might involve selectively presenting medical information to support a predetermined conclusion would also be a serious ethical and regulatory breach. This constitutes a misrepresentation of the medical evidence and a failure to provide a complete and accurate evaluation. The QME has a professional obligation to consider all relevant medical data, not just that which aligns with a particular narrative. A professional decision-making process for similar situations should involve a clear understanding of the QME's role as an independent medical expert. Professionals must prioritize adherence to the regulatory framework governing QME evaluations, which emphasizes objectivity, impartiality, and evidence-based conclusions. When faced with external pressure or requests that appear to steer the evaluation towards a specific outcome, the QME should reaffirm their commitment to an unbiased assessment. If the pressure persists or is overt, the QME should consider recusing themselves from the case to maintain their professional integrity and avoid any appearance of impropriety. The focus must always remain on the patient's medical condition and the objective medical evidence. Question 12. The assessment process reveals that a claimant's diagnostic imaging report for a suspected soft tissue injury contains ambiguous findings, with the radiologist noting possible subtle edema, but no definitive tears. The QME has reviewed the claimant's subjective complaints of pain and limited range of motion, which are consistent with a significant injury. The QME also notes that prior imaging from a different facility showed no abnormalities. How should the QME proceed in interpreting this imaging in their report? Option A. The QME should focus on the possible subtle edema as a definitive finding supporting the claimant's subjective complaints, without further investigation or qualification, to ensure the claimant's reported symptoms are adequately addressed. Option B. The QME should disregard the possible subtle edema finding entirely, as it is not a definitive diagnosis and base the entire report solely on the claimant's subjective complaints and the prior imaging showing no abnormalities. Option C. The QME should acknowledge the ambiguity of the possible subtle edema finding, consider it in conjunction with the claimant's reported symptoms and the absence of findings on prior imaging, and clearly state in the report that the imaging is not definitive for the reported injury, while still evaluating the overall clinical picture. Option D. The QME should immediately request a new, more advanced imaging study, such as an MRI, without first attempting to reconcile the current findings with the clinical presentation or considering the prior imaging to definitively rule out any potential injury. The correct answer is A. The QME should focus on the possible subtle edema as a definitive finding supporting the claimant's subjective complaints, without further investigation or qualification, to ensure the claimant's reported symptoms are adequately addressed. Explanation. The assessment process reveals a common challenge in diagnostic imaging interpretation for qualified medical evaluators, QME. The potential for subjective interpretation to influence objective findings, particularly when imaging is not definitive or when subtle findings are present. This scenario is professionally challenging because the QME's role is to provide an unbiased, evidence-based opinion on the claimant's condition, which directly impacts their medical legal outcome. The integrity of the QME's report hinges on the accurate and objective interpretation of diagnostic imaging. The correct approach represents best professional practice because it prioritizes a comprehensive and objective evaluation of the diagnostic imaging. This involves not only reviewing the images themselves, but also considering the entirety of the medical record, including the mechanism of injury, reported symptoms, and prior diagnostic studies. When imaging findings are equivocal or subtle, a QME must exercise due diligence by seeking clarification from the radiologist if necessary, or by clearly articulating the limitations of the imaging in their report. This aligns with the ethical obligation to provide a truthful and accurate evaluation, as mandated by regulations governing QMEs, which emphasize the importance of evidence-based reporting and avoiding speculation. An incorrect approach that relies solely on a single imaging modality, without considering the clinical context or other available evidence, is professionally unacceptable. This failure to integrate all relevant information can lead to an incomplete or inaccurate assessment, violating the QME's duty to provide a thorough evaluation. Another incorrect approach, such as overinterpreting subtle or nonspecific findings to fit a preconceived diagnosis, represents a significant ethical failure. This constitutes bias and a departure from the objective standard required of a QME, potentially misleading the adjudicating body and harming the claimant. Furthermore, failing to acknowledge the limitations of diagnostic imaging or to seek further consultation when faced with ambiguity demonstrates a lack of professional rigor and a disregard for the principle of providing the most accurate assessment possible. Professional decision-making in such situations requires a systematic approach. First, thoroughly review all provided diagnostic imaging. Second, meticulously examine the entire medical record, correlating imaging findings with the claimant's history, physical examination, and reported symptoms. Third, if imaging findings are equivocal or raise further questions, consider consulting with a radiologist for a second opinion or requesting additional imaging if clinically indicated and permissible. Finally, clearly and precisely articulate all findings, interpretations, and any limitations or uncertainties in the QME report, ensuring that the opinion is grounded in objective evidence and sound medical reasoning. Question 13. Regulatory review indicates that a QME is evaluating a patient presenting with chronic knee pain following a work-related fall. The patient reports significant functional limitations in daily activities. Objective findings include mild degenerative changes on X-ray, but no acute fracture. The QME's report must accurately reflect the patient's condition and its relation to the industrial injury, which approach best aligns with the QME's responsibilities and the regulatory framework for reporting. Option A. The QME should primarily focus on the patient's subjective report of pain and functional limitations, assuming these are directly and solely attributable to the fall, and recommend extensive treatment based on these subjective complaints. Option B. The QME should meticulously document the patient's subjective complaints, correlate them with objective findings such as the degree of degenerative changes on X-ray, and explain how the pathophysiology of osteoarthritis, potentially exacerbated by the fall, contributes to the reported symptoms and functional limitations. Option C. The QME should rely on general principles of pain management, without specifically addressing the underlying pathophysiology of the patient's knee condition or its relationship to the industrial injury. Option D. The QME should base their opinion solely on the X-ray findings, concluding that the mild degenerative changes are not significant enough to cause the reported pain and limitations, and therefore the condition is not work-related. The correct answer is A. The QME should primarily focus on the patient's subjective report of pain and functional limitations, assuming these are directly and solely attributable to the fall, and recommend extensive treatment based on these subjective complaints. Explanation: this scenario is professionally challenging because a qualified medical evaluator, QME, must navigate the complex interplay between the patient's reported symptoms, objective medical findings, and the established pathophysiology of their condition, all within the strict confines of California workers' compensation regulations. The QME's primary duty is to provide an unbiased medical opinion that accurately reflects the applicant's condition and its relationship to the industrial injury, adhering to the medical legal principles and reporting guidelines. The correct approach represents best professional practice because it prioritizes a thorough understanding of the underlying disease process and its manifestation in the individual patient. By integrating the patient's subjective complaints with objective diagnostic data and correlating these with the known pathophysiology of conditions like osteoarthritis, the QME can render a well-supported and defensible opinion. This aligns with the ethical obligation to provide accurate and objective medical evaluations, as mandated by the Division of Workers' Compensation (DWC) regulations, particularly concerning the reporting of medical findings and conclusions. An incorrect approach that focuses solely on subjective complaints without objective corroboration fails to meet the evidentiary standards required for QME reports. This neglects the regulatory requirement for objective findings and can lead to an inaccurate assessment of disability. Another incorrect approach that overemphasizes diagnostic imaging findings without considering the patient's functional limitations and the typical progression of the disease process may lead to an overestimation or underestimation of the impairment. This violates the principle of a holistic medical evaluation and the requirement to consider all relevant medical evidence. An approach that relies on outdated or irrelevant pathophysiological models for the condition would also be a significant regulatory and ethical failure, as it would not reflect current medical knowledge and could lead to an inaccurate and potentially harmful opinion. The professional decision-making process for similar situations should involve a systematic review of the medical record, including the applicant's history, physical examination findings, diagnostic test results, and any prior medical reports. The QME must then apply their knowledge of the relevant pathophysiology to interpret these findings in the context of the reported injury. Crucially, the QME must ensure their report clearly articulates the rationale for their conclusions, referencing specific objective findings and established medical principles, thereby demonstrating compliance with regulatory requirements for comprehensive and evidence-based medical legal reports. Question 14. Stakeholder feedback indicates a concern that some qualified medical evaluators, QME, may be overly influenced by diagnostic imaging results when evaluating patients with chronic back pain, potentially disregarding the patient's reported subjective pain levels and functional limitations. In such a scenario, what is the most ethically and regulatorily sound approach for a QME? Option A. Prioritize the patient's subjective pain reports and functional limitations, even if objective imaging does not fully support the reported severity of the condition. Option B. Adopt the disability assessment of the treating physician without conducting an independent, comprehensive evaluation, especially if there is a discrepancy with initial findings. Option C. Conduct a thorough evaluation that integrates the patient's subjective complaints, physical examination findings, and objective diagnostic imaging results to form an independent medical legal opinion. Option D. Base the disability assessment primarily on objective imaging findings, discounting subjective pain reports if they appear inconsistent with the imaging. Correct answer is C. Conduct a thorough evaluation that integrates the patient's subjective complaints, physical examination findings, and objective diagnostic imaging results to form an independent medical legal opinion. Explanation. Scenario analysis. This scenario presents a professional challenge for a qualified medical evaluator, QME, due to the inherent conflict between a patient's subjective reporting of pain and the objective findings on diagnostic imaging. The QME must navigate the ethical imperative to accurately assess disability and the potential for misinterpretation or over-reliance on imaging, which may not always correlate with functional impairment. The QME's duty is to provide an unbiased medical legal opinion, which requires careful consideration of all available evidence, including the patient's history, physical examination, and diagnostic studies. Correct approach analysis. The correct approach involves a comprehensive evaluation that synthesizes subjective complaints with objective findings. This aligns with the QME's ethical and regulatory obligations to conduct a thorough examination and provide an independent medical legal report. The QME must consider the patient's reported pain levels and functional limitations in conjunction with the imaging results. If imaging is inconclusive or does not fully explain the reported symptoms, the QME must still base their opinion on the totality of the evidence, including the physical examination and the patient's functional capacity. This approach upholds the principle of providing an accurate and unbiased assessment, which is paramount for the integrity of the workers' compensation system. Incorrect approaches analysis. One incorrect approach is to solely rely on objective imaging findings, dismissing the patient's reported pain if it appears disproportionate to the imaging. This fails to acknowledge that pain is a subjective experience and that imaging may not capture all sources of discomfort or functional limitation. It can lead to an underestimation of disability and a denial of appropriate benefits, violating the QME's duty to accurately assess impairment. Another incorrect approach is to exclusively prioritize the patient's subjective complaints without critically evaluating the objective evidence. While patient reporting is crucial, it must be considered within the context of all medical findings. Ignoring or downplaying objective evidence, such as normal or non-contributory imaging, can lead to an overestimation of disability and potentially fraudulent claims, undermining the QME's role as an impartial evaluator. A third incorrect approach is to defer to the treating physician's opinion without independent evaluation, especially if there is a discrepancy between the treating physician's findings and the QME's own assessment. While the treating physician's opinion is valuable, the QME is appointed to provide an independent medical legal evaluation. Failing to conduct a thorough independent assessment and simply adopting another physician's conclusions is a dereliction of the QME's duty. Professional reasoning. Professionals facing similar situations should adopt a systematic decision-making process. First, thoroughly review all available medical records, including the patient's history, prior treatments, and diagnostic studies. Second, conduct a comprehensive physical examination, paying close attention to the patient's reported symptoms and functional limitations. Third, critically analyze the correlation between subjective complaints and objective findings, considering potential explanations for any discrepancies. Fourth, consult relevant medical literature and guidelines to inform the assessment of common medical conditions and their impact on functional capacity. Finally, articulate a clear, well-reasoned medical legal opinion in the QME report, supported by the totality of the evidence and adhering to all regulatory requirements. Question 15. The control framework reveals that a qualified medical evaluator, QME, is tasked with assessing permanent disability for a claimant with a complex musculoskeletal injury. The QME has access to and familiarity with both the AMA guides to the evaluation of permanent impairment, 5th edition, and a state-specific impairment rating schedule. The QME must determine which system to utilize for the impairment rating. Which of the following represents the most appropriate and legally compliant approach for the QME? Option A. Select the AMA guides to the evaluation of permanent impairment, 5th edition, because it is a widely recognized and comprehensive guide for impairment ratings. Option B. Apply the AMA guides to the evaluation of permanent impairment, 5th edition, and then adjust the rating based on subjective factors to account for the claimant's individual circumstances. Option C. Combine elements from both the AMA guides and the state-specific schedule to create a hybrid rating that best reflects the claimant's overall impairment. Option D. Utilize the state-specific impairment rating schedule as it is the most current and directly applicable to the jurisdiction's workers' compensation laws. The correct answer is D. Utilize the state-specific impairment rating schedule as it is the most current and directly applicable to the jurisdiction's workers' compensation laws. Explanation: the scenario presents a common challenge for qualified medical evaluators, QME, when faced with multiple, potentially conflicting, impairment rating systems. The professional challenge lies in selecting the most appropriate and legally defensible system for a given case, ensuring consistency, accuracy, and adherence to regulatory mandates. This requires a deep understanding of the applicable legal framework and the nuances of each rating system. The correct approach involves a thorough review of the governing statutes and regulations to determine which impairment rating system is mandated or preferred for the specific type of injury or condition being evaluated. Best professional practice dictates adherence to the legally prescribed methodology, as this ensures the integrity of the evaluation and its acceptance by the workers' compensation system. This aligns with the ethical obligation of a QME to provide objective and legally compliant medical opinions. An incorrect approach would be to arbitrarily select an impairment rating system based on personal preference or ease of application, without consulting the governing regulations. This failure to adhere to the mandated framework constitutes a regulatory violation and an ethical breach, as it undermines the fairness and impartiality expected of a QME. Another incorrect approach is to blend elements from different rating systems without explicit regulatory authorization. This can lead to an unsupportable rating that lacks a clear basis in established guidelines, potentially resulting in disputes and legal challenges. The professional decision-making process should begin with identifying the specific jurisdiction and the relevant workers' compensation laws. The QME must then consult the official guidelines and regulations to ascertain the prescribed impairment rating system for the injury in question. If multiple systems are permissible, the QME should select the one that most accurately reflects the claimant's functional limitations according to the established criteria. Documentation of the chosen system and the rationale for its selection is crucial for transparency and defensibility. Question 16. Implementation of a comprehensive anatomical and physiological assessment for a QME evaluating a patient reporting widespread somatic symptoms following a specific traumatic event, where the reported symptoms extend beyond the immediate site of injury, requires the QME to: Option A. Systematically investigate the potential for referred pain, nerve impingement, and systemic physiological responses by correlating the patient's subjective complaints with established anatomical pathways and known physiological sequelae of trauma. Option B. Speculate on novel anatomical or physiological mechanisms to explain the patient's symptoms, even if these mechanisms are not supported by current medical literature or established scientific principles. Option C. Rely exclusively on the patient's self-reported symptom severity and duration to determine the extent of anatomical and physiological impairment, without conducting independent objective assessments. Option D. Primarily focus on the most visible and objectively measurable physical findings at the site of the reported injury, and attribute any other reported symptoms to pre-existing conditions or psychological factors without further investigation. The correct answer is A. Systematically investigate the potential for referred pain, nerve impingement, and systemic physiological responses by correlating the patient's subjective complaints with established anatomical pathways and known physiological sequelae of trauma. Explanation: the scenario presents a challenge for a qualified medical evaluator, QME, tasked with evaluating a patient's injury claim. The core difficulty lies in accurately correlating subjective patient complaints with objective anatomical and physiological findings, particularly when the patient's reported symptoms extend beyond the immediately apparent physical injury. This requires a deep understanding of how various bodily systems interact and how trauma to one area can manifest in seemingly unrelated symptoms, necessitating a comprehensive anatomical and physiological knowledge base to avoid misdiagnosis or incomplete assessment. The correct approach involves a thorough anatomical and physiological assessment that considers the interconnectedness of the body's systems. This means not only examining the site of the reported injury, but also understanding the potential for referred pain, secondary effects on adjacent or distant structures, and systemic responses to trauma. For example, a back injury might present with radiating leg pain, sciatica, due to nerve compression, or even impact the gastrointestinal system through autonomic nervous system disruption. A QME must be able to identify these potential connections based on their understanding of neuroanatomy, musculoskeletal biomechanics, and physiological responses to injury. This aligns with the QME's duty to provide an accurate and comprehensive evaluation, ensuring that all relevant factors contributing to the patient's disability are identified and documented according to established medical legal standards. An incorrect approach would be to solely focus on the most obvious physical manifestation of the injury, ignoring or downplaying subjective complaints that do not immediately fit a simple anatomical model. For instance, dismissing a patient's report of fatigue or cognitive difficulties following a significant musculoskeletal injury without investigating potential physiological underpinnings like chronic pain syndromes, sleep disturbances secondary to pain, or even neuroinflammatory responses would be a failure. This approach violates the QME's ethical obligation to conduct a complete evaluation and could lead to an inaccurate impairment rating, failing to adequately represent the patient's functional limitations. Another incorrect approach would be to speculate on diagnoses or physiological mechanisms without a solid anatomical or physiological basis, or to rely solely on the patient's self-report without objective correlation. This demonstrates a lack of understanding of the scientific principles underlying medical evaluation and could lead to unsubstantiated conclusions, undermining the integrity of the QME process. The professional decision-making process for similar situations requires a systematic approach. First, the QME must meticulously gather all available information, including the patient's history, mechanism of injury, and all reported symptoms. Second, they must apply their knowledge of anatomy and physiology to hypothesize potential underlying causes and interconnected effects of the reported symptoms. Third, they must conduct a thorough physical examination, utilizing diagnostic tests where appropriate, to objectively assess the patient's condition and correlate findings with the hypothesized mechanisms. Finally, the QME must synthesize all data to form a well-reasoned medical legal opinion, clearly articulating the anatomical and physiological basis for their conclusions and any limitations in their assessment. Question 17. Quality control measures reveal that a qualified medical evaluator, QME, has completed a report for an injured worker alleging psychological injury, specifically anxiety and depression, stemming from a workplace incident. The report details the worker's subjective complaints of persistent worry, low mood, and sleep disturbances. However, the report lacks specific objective findings from a psychiatric examination, does not clearly delineate the diagnostic criteria met for anxiety and depression, according to the AMA guides, to the evaluation of permanent impairment, and does not explicitly link the diagnosed conditions to the industrial injury with a clear statement of causation. Which of the following approaches best reflects the QME's regulatory obligations in this scenario? Option A. The QME should rely on the worker's detailed subjective complaints, as these are the primary indicators of psychological distress, and assume the conditions are industrially caused given the reported incident. Option B. The QME should supplement the report by conducting further diagnostic testing, clearly articulating the objective findings, specifying the diagnostic criteria met for anxiety and depression as per the AMA guides, and providing a definitive statement on the causation and apportionment of the psychological condition to the industrial injury, ensuring all elements required by the California Division of Workers' Compensation, DWC, are addressed. Option C. The QME should focus on the worker's ability to perform their usual occupation based on their reported symptoms, without needing to explicitly detail diagnostic criteria or causation, as the worker's functional limitations are the most critical aspect for benefit determination. Option D. The QME should issue a revised report that primarily emphasizes the worker's emotional distress and its impact on their daily life, without needing to strictly adhere to the AMA guides or DWC reporting requirements, as the focus should be on the worker's overall well-being. The correct answer is B. The QME should supplement the report by conducting further diagnostic testing, clearly articulating the objective findings, specifying the diagnostic criteria met for anxiety and depression as per the AMA guides, and providing a definitive statement on the causation and apportionment of the psychological condition to the industrial injury, ensuring all elements required by the California Division of Workers' Compensation, DWC, are addressed. Explanation. This scenario presents a professional challenge because the qualified medical evaluator, QME, must navigate the complexities of diagnosing and reporting on psychological conditions, specifically anxiety, depression, and PTSD, within the strict confines of California workers' compensation regulations. The QME's report is a critical document that directly impacts the injured worker's benefits and the employer's liability. Ensuring the report is accurate, objective, and compliant with the relevant statutes and guidelines is paramount. The challenge lies in distinguishing between subjective reporting of symptoms and objective medical findings, and in articulating these findings in a manner that is both medically sound and legally defensible. The correct approach involves a thorough evaluation that adheres strictly to the California Division of Workers' Compensation, DWC, regulations, and the AMA guides to the evaluation of permanent impairment. This includes obtaining a comprehensive history, conducting a detailed psychiatric examination, utilizing appropriate diagnostic tools, and clearly articulating the findings in the QME report. The report must specifically address the elements required by the DWC, such as the mechanism of injury, the relationship of the condition to the industrial injury, and the extent of temporary and permanent disability. The QME must also be mindful of the specific criteria for diagnosing anxiety, depression, and PTSD, as outlined in the AMA guides and relevant psychiatric diagnostic manuals, ensuring that the diagnosis is supported by objective findings and not solely based on the patient's subjective complaints. This meticulous adherence to regulatory requirements and established medical standards ensures the report is fair, accurate, and legally sound, representing best professional practice. An incorrect approach would be to rely solely on the injured worker's self-reported symptoms without corroborating objective findings or a thorough psychiatric examination. This fails to meet the regulatory requirement for objective medical evidence and could lead to an inaccurate assessment of disability. Another incorrect approach would be to diagnose a psychological condition without clearly linking it to the industrial injury, or without specifying the degree of impairment according to the AMA guides. This would violate the QME's duty to provide a comprehensive and legally compliant report. Furthermore, failing to document the specific diagnostic criteria met for anxiety, depression, or PTSD, or not clearly articulating the impact of these conditions on the worker's ability to perform their usual occupation, constitutes a significant regulatory and ethical failure. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review all available medical records and the worker's reported mechanism of injury. Second, conduct a comprehensive psychiatric evaluation, including a detailed history, mental status examination, and consideration of appropriate psychological testing if indicated. Third, apply the diagnostic criteria from the AMA guides and recognize psychiatric manuals to the gathered information. Fourth, clearly articulate the findings in the QME report, ensuring all required elements are addressed, including causation, apportionment, and impairment ratings, all while strictly adhering to California DWC regulations. Question 18. Stakeholder feedback indicates that some qualified medical evaluators, QME, are hesitant to proceed with independent medical evaluations for patients with complex neurological disorders, such as chronic headaches, peripheral neuropathies, or spinal cord injuries, when the treating physician expresses strong disagreement with the necessity of the QME's involvement. In such instances, what is the most appropriate course of action for a QME? Option A. Inform the requesting party that the evaluation cannot proceed due to the conflict with the treating physician, and advise them to obtain a second opinion from a different specialist rather than proceeding with the QME process. Option B. Proceed with the independent medical evaluation as scheduled, conducting a thorough review of all provided medical records and performing a comprehensive examination to form an independent medical opinion, regardless of the treating physician's stance. Option C. Accept the treating physician's existing medical opinions and documentation as definitive, and simply issue a report confirming those findings without conducting an independent examination or forming a separate opinion. Option D. Decline to perform the evaluation, citing the treating physician's objection and suggesting that the parties resolve their differences directly with the treating physician. The correct answer is B. Proceed with the independent medical evaluation as scheduled, conducting a thorough review of all provided medical records and performing a comprehensive examination to form an independent medical opinion, regardless of the treating physician's stance. Explanation. This scenario presents a professional challenge due to the inherent conflict between a treating physician's established clinical opinion and the request for an independent medical evaluation, QME, by a different entity, potentially for litigation or insurance purposes. The QME must navigate the ethical imperative to provide an unbiased, objective assessment while respecting the existing physician-patient relationship and the integrity of the medical record. Careful judgment is required to ensure the QME's evaluation is thorough, fair, and compliant with all applicable regulations. The correct approach represents best professional practice because it prioritizes the QME's statutory duty to conduct an independent medical evaluation as mandated by the relevant jurisdiction's workers' compensation laws. This involves reviewing all available medical records, conducting a thorough examination, and forming an independent medical opinion based on objective findings and established medical literature, irrespective of prior opinions. This aligns with the QME's role as an impartial medical expert appointed to resolve disputes. The QME's obligation is to the integrity of the evaluation process and the legal framework governing it, not to the preferences of the treating physician or any other party. An incorrect approach that involves refusing to conduct the evaluation solely because the treating physician disagrees with the need for an IME is a regulatory failure. QMEs are appointed to provide independent assessments, and refusal based on the treating physician's opinion undermines this fundamental role. Another incorrect approach, such as adopting the treating physician's conclusions without independent review, constitutes a breach of ethical and regulatory obligations. The QME's duty is to perform a de novo evaluation, not to rubber stamp existing documentation. Failure to conduct a comprehensive examination and review all relevant records before forming an opinion is also a significant regulatory and ethical lapse, as it compromises the objectivity and validity of the QME's findings. Professionals should approach such situations by first understanding the specific statutory requirements for QMEs in their jurisdiction, particularly regarding the scope of their duties and the process for conducting independent medical evaluations. They should then meticulously review all provided documentation, conduct a thorough physical examination relevant to the claimed neurological conditions, headaches, neuropathies, spinal cord injuries, and synthesize this information with current medical literature. If there are significant discrepancies or missing information, the QME should document these and may need to request additional records or clarification. The final report must be objective, evidence-based, and clearly articulate the QME's findings and rationale, adhering strictly to reporting guidelines. Question 19. Cost-benefit analysis shows that while X-rays are generally the least expensive imaging modality, their diagnostic utility is limited for certain types of work-related injuries. Considering the need for accurate diagnosis and efficient claim resolution, which of the following approaches best reflects a QME's professional responsibility when selecting an imaging modality for a suspected soft tissue injury of the knee? Option A. Ordering an MRI due to its superior soft tissue visualization capabilities, even if an ultrasound might provide sufficient initial information for the suspected injury. Option B. Selecting an ultrasound as the initial imaging modality for suspected soft tissue injury, as it is cost-effective and can often identify superficial tears or effusions, with MRI considered if ultrasound findings are equivocal or suggest deeper pathology. Option C. Prioritizing a CT scan to obtain detailed cross-sectional views of both bone and soft tissue, as it provides comprehensive information for all knee injuries. Option D. Recommending an X-ray to rule out bony pathology, and then proceeding with further imaging only if the X-ray is inconclusive and soft tissue injury is still suspected. The correct answer is A. Ordering an MRI due to its superior soft tissue visualization capabilities, even if an ultrasound might provide sufficient initial information for the suspected injury. Explanation. Scenario analysis. A qualified medical evaluator, QME, is tasked with determining the most appropriate imaging modality to assess a patient's work-related injury. The challenge lies in balancing diagnostic accuracy, patient safety, cost-effectiveness, and the specific requirements of the workers' compensation system, all while adhering to established medical guidelines and regulatory frameworks. The choice of imaging can significantly impact the diagnosis, treatment plan, and ultimately the outcome of the claim. Correct approach analysis. The correct approach involves a thorough understanding of the strengths and limitations of each imaging modality, X-ray, MRI, CT, ultrasound, in the context of the suspected injury. This requires the QME to consider the specific anatomical structures involved, the suspected pathology, and the information each modality is best suited to provide. For instance, X-rays are excellent for bone fractures and alignment. CT scans offer detailed cross-sectional views of bone and some soft tissues. MRI provides superior soft tissue contrast for ligaments, tendons, and muscles. And ultrasound is useful for superficial soft tissues and fluid collections. The QME must select the modality that will yield the most diagnostically relevant information for the specific clinical question, while also considering factors like radiation exposure for X-ray and CT, and contraindications, e.g., metal implants for MRI. This aligns with the QME's duty to provide an objective and thorough medical evaluation, supported by appropriate diagnostic tools as outlined in the relevant workers' compensation regulations, which emphasize evidence-based medicine and cost-effective care. Incorrect approaches analysis. One incorrect approach would be to solely rely on the least expensive imaging modality, such as an X-ray, even when the suspected injury clearly involves soft tissues, where an X-ray would be insufficient to provide a diagnosis. This fails to meet the standard of a comprehensive medical evaluation and could lead to misdiagnosis or delayed treatment, violating the QME's ethical obligation to provide accurate and complete evaluations. It also disregards the regulatory requirement for appropriate diagnostic testing to support the medical findings. Another incorrect approach would be to order the most advanced or comprehensive imaging modality, such as an MRI, for every injury, regardless of its suitability or necessity. While MRI offers excellent detail, it is also more expensive and time-consuming. Ordering unnecessary advanced imaging exposes the patient to potential risks, though generally low for MRI, and incurs costs that may not be justifiable by the diagnostic yield, potentially violating cost containment principles within the workers' compensation system and the QME's duty to order only medically necessary diagnostic tests. A third incorrect approach would be to choose an imaging modality based on personal preference or familiarity, without considering the specific clinical question or the established efficacy of different modalities for particular injuries. This demonstrates a lack of professional diligence and adherence to evidence-based practice, which is a cornerstone of QME evaluations. It also fails to consider the specific guidelines that may dictate the preferred imaging for certain types of injuries within the workers' compensation framework. Professional reasoning. Professionals should approach this scenario by first identifying the chief complaint and suspected diagnosis based on the patient's history and physical examination. Then, they should consult relevant medical literature and workers' compensation guidelines to determine the most appropriate imaging modality for that specific suspected pathology. This involves a systematic evaluation of the diagnostic capabilities of X-ray, CT, MRI, and ultrasound, considering their respective advantages, disadvantages, costs, and risks. The decision-making process should be documented thoroughly, justifying the choice of imaging based on its diagnostic utility and adherence to regulatory requirements for medical necessity and cost-effectiveness. Question 20. Investigation of a patient's history of industrial injury by a qualified medical evaluator, QME, requires careful consideration of interview techniques. Which of the following approaches best ensures a comprehensive and unbiased assessment of the patient's subjective complaints and the mechanism of injury, in accordance with California QME regulations? Option A. Primarily rely on the claimant's pre-existing medical records, only asking brief clarifying questions if significant discrepancies are noted to maximize efficiency. Option B. Begin with broad, open-ended questions to allow the patient to narrate their experience, then use targeted clarifying questions to elicit specific details about the injury, symptom onset, progression, and prior treatments, while maintaining neutrality and actively listening. Option C. Focus the majority of the interview on the patient's non-industrial medical history and personal life, as these factors often influence symptom perception and reporting. Option D. Lead the patient with specific questions about the injury's mechanism and symptoms, assuming a particular narrative based on the initial complaint, to quickly confirm details. Correct answer is B. Begin with broad, open-ended questions to allow the patient to narrate their experience, Then use targeted clarifying questions to elicit specific details about the injury, symptom onset, progression, and prior treatments, while maintaining neutrality and actively listening. Explanation. The scenario presents a challenge for a qualified medical evaluator, QME, tasked with assessing a patient's history of industrial injury. The core difficulty lies in balancing the need for a comprehensive and accurate history with the practical constraints of time and the potential for patient recall bias or subjective reporting. A QME must elicit information that is both relevant to the claimed injury and objective enough to form the basis of a medical legal opinion, adhering strictly to the California Labor Code and relevant administrative directives. Add regulations. The correct approach emphasizes a structured yet empathetic interview technique that prioritizes open-ended questions initially, followed by targeted clarifying inquiries. This method allows the patient to provide their narrative freely, minimizing the risk of leading questions or premature assumptions. The QME's role is to actively listen, probe for details regarding mechanism of injury, symptom onset, progression, and prior treatments, all while maintaining neutrality. This aligns with the ethical obligation to conduct a thorough and unbiased evaluation, as mandated by the QME regulations, which require the evaluator to obtain a complete medical history relevant to the injury. The importance of a detailed history is paramount as it forms the foundation for diagnosis, causation, and impairment ratings, directly impacting the worker's compensation claim. Incorrect approaches fail to meet the professional and regulatory standards. One incorrect approach might involve solely relying on pre-existing medical records without a direct patient interview. This is a regulatory failure because the QME is required to conduct an independent medical evaluation, which inherently includes interviewing the patient. Relying solely on records bypasses the opportunity to clarify ambiguities, assess the patient's current subjective complaints, and observe their demeanor, all of which are crucial for a comprehensive evaluation. Another incorrect approach could be to dominate the interview with leading questions, or to dismiss the patient's subjective complaints without adequate exploration. This is an ethical and regulatory failure, as it compromises the objectivity of the evaluation and fails to gather all relevant information. The QME must remain impartial and ensure the patient has a full opportunity to present their history. A third incorrect approach might be to focus excessively on non-industrial history, diverting from the core purpose of the QME evaluation. While some background is necessary, the primary focus must remain on the industrial injury and its sequelae, as stipulated by the scope of a QME evaluation. Professional decision-making in such situations requires a systematic approach. First, understand the specific regulatory requirements for QME evaluations in California, particularly concerning history taking. Second, employ active listening and empathetic communication skills to build rapport and encourage open disclosure. Third, utilize a combination of open-ended and specific, non-leading questions to gather detailed information about the injury, symptoms, and treatment. Fourth, critically evaluate the patient's history for consistency, plausibility, and relevance to the claimed industrial injury, cross-referencing with available medical records where appropriate. Finally, document the history meticulously, noting any discrepancies or limitations.